So a little bit about me. I am a remedial massage therapist and I'm also Blotter and Foldy trained. And I actually am a trainer for massage therapists to learn about lymphatics. So I run bodywork massage training and I help massage therapists to niche their skills in lymphatics through the technique of the MyoMLD, which is myofunctional manual lymphatic drainage modality. And it allows the therapist to craft their skills to work with complex pathologies. I have run many successful workshops and seminars to educate clients, therapists and nurses on the knowledge of the lymphatic system and the benefits of self-care between treatments. Today I'm going to present on the benefits of implementing a home-based program into your clinic and describe some of the aspects that you should consider when implementing a home-based care program. Your skills as a manual lymphatic drainage massage therapist raise your profile to be a health leader. As a MT or massage therapist, your approach to the treatment of lymphatic conditions is a holistic one. Research has found that MLD is most beneficial when performed for 60 to 90 minutes, allowing the soul state to occur, which is the fluid-like state, which is more water-based or more water consistency compared to the gel state in the extracellular space. The lymphatic system then can pick it up and eliminate from the body. Like the great sculptor of Constantine, your skills are like no other. There is no other therapy or practitioner, to my knowledge, that spends so much time with a client doing the hands-on treatment to allow that beneficial state of the soul, to allow that beneficial step of the soul state to occur. The holistic approach that a massage therapist gives to a treatment for those living with lymphatic conditions is priceless. So you are unique in as a health leader in your community. So let's have a look at the client's journey living with a lymphatic condition like lymphoedema. So it's extremely important to understand the individual patient's journey and the issue to achieve optimal outcomes for management so that the client can live an active and proactive life. It is important to treat the whole person in a holistic way, not just treat the affected limb. Many clients are not given enough advice or feel their lymphatic health concerns are brushed under the carpet. And this leads to expensive and exhausting processes. Working with inexperienced therapists and the emotional journey that the client experiences impacts the overall health and well-being for the individual and can feel like a lonely journey. The expense builds up and is exhausting. So this also adds up to relying upon other people to manage their condition and feeling like that they are a number, not a human being. The MLD therapist can educate on how to look after the lymphatic condition and treat the client, helping to reduce the impact of the big health bills that they experience. What you're actually doing is actually educating your clients to maintain their condition between treatments so they can actually space out their treatments to every 4 to 6 weeks to manage at home the condition. It also reduces the burning costs of the public health system by poorly managed lymphatic conditions. And this can be seen in hospital beds being taken up by people that can manage their lymphatic condition at home quite easily, and a number of other reasons. As we start to look outside of our community and the availability for rural clients to access resources, this actually diminishes. So rural clients can spend hours travelling to their closest qualified therapist to get regular treatments, placing more pressure on time and money than if the client isn't able to use their own transport and must hire transport like a taxi. The cost can be a major stress on the client, getting together hundreds of dollars for one trip, and that can actually be quite expensive when we start to look at their socio-economic level as well, because a lot of people have had to actually stop working due to their health concerns, and therefore money is tight. So as a qualified therapist, implementing a home-based lymphatic care program into your treatment plan will benefit this demographic of clients. It'll also open up your availability to help those living in rural areas to access resources that can be hard to access. Now, the other thing to consider is, as a therapist, is time, and time is a limited equity in clinical practice. Generally in clinic, you don't have enough time to cover all the self-care routines. You are generally also doing a lot of after-hours self-care videos and sending them off to clients, or drawing up diagrams and programs for them and sending off to clients. And that when you use that space in your appointment time, it actually reduces the effectiveness of the 60-minute treatment in a 1-hour appointment. So that treatment time, like I said earlier, research has shown the 60 to 90 minutes actually allows the person to, the lymphatic system, to access that soul state of the fluid. We must encourage the community, clients and families to continue to learn about personal health for living with lymphatic conditions as well. And this is your skills and resources are actually beneficial to them. So what it does is allows you to be effective in treatment. Also, having a home-based lymphatic care program then gives you the opportunity to continue to keep educating your clients on looking after their lymphatic condition between treatments. And this allows you to have amazing results in clinic with your clients. So I recently did an email correspondence with Neil Pillar to ask some questions, and what I asked was, how do we go about educating our clients for them to understand the benefits of doing this program? And what he actually came back with was, regarding one thing to say in between treatments to patients is to remember the little things that can make a difference. As an example, lymph flow from the arm is about 5 mils per hour, and from the leg about 20 mils per hour. And it doesn't take much to improve or worsen the lymph flow by these amounts. So a home-based lymphatic care program is effective in reducing morbidity in clients living with lymphatic conditions, and requires no additional resources like your time outside of the clinic space to create videos or to write up programs and send off to your clients. A home-based lymphatic care program can also be replicatable. So therefore, once you've done it once, it can actually be reused time and time again, and is very effective to help your clients understand that the looking after the lymphatic system doesn't rest on the therapist, it rests on them to actually be a proactive member of their healthcare plan. So educating clients on the steps to managing their lymphatic health will reduce acute attacks of cellulitis, reducing that stressed healthcare system that we actually have. Letting your clients know, and for you as a therapist to be aware, that data sources can provide evidence for clinical action, and we should consider them all in educating clients in self-care. Educating the client that not everything needs to be done every day, but every small step helps to maintain and help them achieve an active and proactive life living with lymphatic conditions. So home-based programs encourage our clients to take control of their health, empower them to stay active, and understand research and knowledge is always moving forward. So patients will actually perceive the gap that there is in the medical industry on lymphatics. And our role as a therapist is to help them understand that something is better than nothing. If nothing is done, the problem will probably worsen. And that reflects quite strongly with what Neil Pillar has let me know in a recent communication. So your heart-centered practice is really important when working with those that have lymphatic conditions. So Gutenstein, in a research in 2016, stated, "Healthcare lies in the word. It is the art of providing not just technical outcomes, but a feeling of being cared for and a sense of control, a personal journey and an individual narrative." While we may implement these home-based lymphatic care programs online for the world to access or on a pile of notepaper, it is a heart-centered practice or experience and passion to help those with lymphatic conditions that holds the hands of our clients, helping them navigate the journey that they have ahead of them. Research on the effectiveness of home-based programs are typically based on lymphatic fluorosis in the tropical areas. The WHO, the World Health Organization, strategy for managing lymphedema is based on a rigorous skin hygiene, antibiotics, and is aimed at reducing acute attacks of cellulitis. The results suggested that the home-based program was effective in reducing morbidity, and required no additional. The research by Julian in 2011 states the washing program that they studied included therapists actually teaching clients how to manage the condition through a home-based program and was aimed at maintaining, monitoring and restoring health in the client's home by the client or their family members. So also carers can be involved in the management of these conditions through a home-based lymphatic care program. Clients were then advised when they should seek medical care, and the responsibility was given to the client, which is more sustainable, more of a sustainable process than relying entirely on the public health care system.